So let's continue our discussion regarding tumor markers. And the next tumor marker is CA125. So CA125, it's for ovarian, okay, ovarian cancer. So five buntis, okay, ovarian cancer. So it's an oncofetal antigen produced by ovarian epithelial cells. And early studies found that less than 1% of apparently healthy individuals and about 6% of patients with benign disease had elevations of CA125. Now, greater than 80% of patients with ovarian carcinoma had elevated CA125 values. Okay, so remember, CA125 it's for ovarian cancer. And CA125 uh, correlate, okay, it has a good relationship with the tumor burden and also the extent of the disease or extent of ovarian cancer. So regarding tumor burden, the meaning of tumor burden, it's the amount of cancer cells present in the body. Okay, so meaning the higher the concentration of CA125, okay, the it also it correlates increase or uh, increase number of cancer cells, okay, in the body. Okay, so more cancer cells ang present sa body if there's elevation in CA125. The higher the concentration of CA125, meaning mas higher po ng concentration of or higher po ng number sa tumor or cancer cells in the body. Okay, so that's for use of CA125 correlation, okay, with the tumor burden. Okay, next, you have elevated CA125 levels are also observed in patients with advanced non-ovarian gynecological malignancies, including endometrial cancer, and in those with metastatic malignancies of the breast, colon, pancreas, and lung. So CA125 is also elevated in other forms of cancer or types of cancer like breast cancer that already metastasized, colon cancer, pancreas, and lung cancer nga nagmetastasize na. So it's not that specific to ovarian cancer. Okay, so mild elevations are observed in several benign conditions, including menstruation. So there's also increase in CA125 during menstruation, pregnancy, benign cysts, endometriosis, and cirrhosis. Now, regarding endometriosis, it's a painful disorder the uh, where there is development, okay, of endometrium. Okay, so usually, or the normal location of endometrium is inside the, or it lines your uterus. Okay, it lines it's the lining of the uterus. Now, in endometriosis, it is a painful disorder where there is development of endometrium outside the uterus. Okay, that's for endometriosis. Okay, so patients with palpable pelvic mass, okay, so usually if the presence of pelvic mass indicates the presence of ovarian cancer or there's a problem with the uterus or the ovaries, okay? So CA125 levels are higher than 35 IU per ml or 10 times the normal concentration. So if there's palpable pelvic mass, the expected level of CA125 is greater or higher than 35 IU per ml. Okay, and that's 10 times the normal concentration of CA125. So it's not highly sensitive for cancer in early stages of the disease, and it cannot differentiate between benign and malignant disease. Okay, so the problem with CA125, yes, it's indicative of ovarian cancer, but not specific to ovarian cancer because there are other diseases, other forms of cancer or types of cancer, and benign conditions that are associated with increase in CA125. Now, regarding CA125, the use, it's not for diagnostic, but For example, to estimate the tumor burden, okay, or the extent of the disease. That's the use of CA125, not in the giving of definitive diagnosis. Okay. So the major clinical use of CA125 is to monitor the treatment response of ovarian carcinoma. How or if the uh, surgery is successful or not. Okay, that's the major use of CA125. Okay, so CA125 levels that do not normalize after initial therapy are indicative of residual disease, meaning napainabilin. There's a small amount of cancer cells present, okay, even after therapy. Okay. Rising CA125 levels after surgery or chemotherapy almost always represent cancer recurrence. So if the levels of CA125 is still abnormal and it's increasing after surgery, then it represents or indicates that there is cancer recurrence, or meaning ni appear na sad usab ang cancer. Okay, so after the removal, then nag-start na po the cancer, produce of cancer cells. Okay. A normal CA125 level, however, does not always indicate absence of tumor recurrence, because CA125 will elevate if the tumor is greater than 2 cm in size. It will only elevate in concentration if greater than 2 cm ang size. If less than 2 cm, the CA125 less than 2 cm ang tumor, then CA125 is still normal in terms of concentration. Okay? So, does that mean after surgery, okay, if the CA125 is less than no, if CA125 is in normal concentration, doesn't mean the patient is free of cancer. Okay, you need multiple times or multiple testing of uh, for CA125 to conclude that there's no recurrence of cancer, because if the tumor size is less than 2 cm, it will not give you an abnormal result. Okay, so you need multiple testing. Okay, so multiple results of a normal CA125 to have a conclusion that there's no recurrence of cancer after surgery or after chemotherapy. Okay, and it's a useful prognostic indicator, so meaning CA125 level is good prognostic indicator, meaning you can use CA125 to predict if the patient will have higher chance of survival from ovarian cancer or not. Okay, so the higher the concentration of CA125, the lesser the chance nga mo survive ang patient. Okay, so increased levels of CA125 after surgery are associated with shortened survival. Okay, so after surgery, if CA125 is still elevated, then there's high possibility nga ma-dead po dayon ang patient. The amount of time nga buhi pa siya or alive pa siya kaya mas short. Okay? If high kaya ang levels of CA125 after surgery. Okay? Next tumor marker, I have CA19-9. So initially identified in human colorectal carcinoma cell line, and it's elevated in numerous malignancies including colon, gastric, hepatobiliary, and pancreatic cancer. So CA19-9 is not that specific for a certain type of cancer. Okay. Also be elevated in benign disorders such as pancreatitis, extrahepatic cholestasis, and cirrhotic liver disease. And since it's not that specific for a particular or certain type of cancer, it's not a useful screening test for cancer. Okay, not useful as a screening test for cancer because it's not specific. It's more sensitive and specific than CEA for pancreatic cancer, but it cannot identify patients with early resectable pancreatic cancer. Meaning of resectable, it's a type of tumor that is able to be removed, okay, with surgery. Okay, so it's a um, type of tumor that ma-remove siya via surgery. Okay, that's the meaning of resectable. Okay. Now, regarding cutoff value of 40 U per ml, if you'll use cutoff of 40 U per ml, it's elevated in 81% of patients with pancreatic cancer. Meaning, if usually individuals with pancreatic cancer, they have a value, 81% of those with pancreatic cancer, they have values CA19-9 value of greater than 40. Okay, and 96% of patients with pancreatic cancer have CA19-9 value of greater than 100. Okay, 96%. Okay. Now, regarding CA19-9, it's elevated in 50 to 60% of patients with gastric carcinoma. Okay, so it's not specific for pancreatic cancer, and 60% of patients with hepatobiliary cancer, and 30% of patients with colorectal carcinoma. Okay, now the specificity of CA19-9 for pancreatic cancer is further lowered further further lowered by increased 19-9 levels typically found in patients with benign pancreatitis. So meaning your CA19-9, it's not that specific for pancreatic cancer. Uh, in addition to that, it's because if the patient has pancreatitis, a benign disease, CA19-9 is also elevated. Okay, so because patients with benign pancreatitis usually have serum 19-9 elevations that do not normally exceed 120 U per ml, the specificity of CA19-9 can be improved by increasing the cutoff value for pancreatic cancer. So instead of using low cutoff value for CA19-9, in order to use CA19-9 effectively for pancreatic cancer, uh, the thing that you need to do to solve that problem is to improve, or no, to increase the cutoff value. Instead of 40, use 120, because for pancreatitis, it will not exceed the 120 U per ml value. Okay, so that's the solution daw. But the problem is a cutoff value of 120 U per ml would severely limit the use of CA19-9 for pancreatic cancer, because there are patients, okay, uh, during the early stages of the disease, that their CA19-9 levels is less than 120 per ml. Okay, so it's not a good solution, okay, to the problem regarding the specificity of CA19-9 to pancreatic cancer, to lower, oh no, to increase the cutoff value to 120. Okay, so the reason why, okay, let's go back the reason why na yung mga ideas to increase the cutoff value to 120 is, the reason to that is to separate uh, pancreatic cancer from benign pancreatitis, or benign disease of the pancreas. Because if there is involvement of the pancreas, it is expected that there's elevation in, okay, elevation in CA19-9. Now, regarding CA19-9 value, it's elevated in benign pancreatic disorders, but it will not reach or exceed 120 U per ml. So the solution is to change or increase the cutoff value to 120. But the problem to that is, if you change the cutoff value to 120, during the early stage of pancreatic cancer, the value of CA19-9 usually will not reach 120. So meaning, if you'll change the cutoff to 120, then you'll not be able to spot the early stage of pancreatic cancer. Okay, so CA19-9 is often used in conjunction with CAA, okay, to monitor recurrence of the disease. And CA19-9 returned to normal after successful surgical removal. And so, for example, if there's pancreatic cancer, the surgeon will remove the portion of the pancreas uh, that contains cancer or that has cancer. Then, if that surgery is effective, then CA19-9 will go back to normal or return to normal, okay, in terms of concentration. Now, for the recurrence of of pancreatic cancer, uh, there's an increase na of CA19-9, 7 to 9, 7, no, 1 to 7 months before the clinical diagnosis of relapse or recurrence. So meaning, CA19-9 is highly effective in monitoring the effect of surgery and also the possibility of recurrence, okay, of the disease. Okay, so usually CA19-10, it's not that useful in diagnosis, but it is useful in monitoring the success of the surgical removal or treatment and the possible recurrence of the disease or relapse. Okay. Okay, so next tumor marker, you have CA15-3. So 15-33, okay, breast, okay. So present in mammary epithelium, it's elevated in patients with metastatic breast, pancreatic, lung, colorectal, and liver cancer. But it's usually used for breast cancer. So elevated in benign disease of the breast and liver, and it's elevated in less than 33% of patients with stage 1 or stage 2 breast cancer. So regarding CA15-3, it's not that effective uh, in identifying or in the detection of early stage of breast cancer. So for example, stage 1 or stage 2, okay? So it's not effective because it's that most of the cases of stage 1 and stage 2 breast cancer, their CA15-3 is not elevated. Okay, so only 33% or less than 33% is increased during stage 1 and stage 2. Stage 1 and stage 2. Okay, so it's more useful in identifying patients with advanced stages of breast cancer because 79 to 92% of patients with progressive disease have elevations of CA15-3. So it's useful in detection of advanced stage of breast cancer, not the early stages of breast cancer. Okay, so it's not recommended for monitoring therapeutic response because declining levels do not always occur in patients undergoing successful therapy. Okay, so it's not that effective for monitoring treatment or the effectiveness of a treatment, but the use of CA15-3, it correlates with tumor burden, okay? Meaning the amount of cancer cells inside the body, okay, or in the breast. So if there's increased CA15-3, it's indicative that there are a lot of cancer cells in the breast, okay? So, and if there's increased tumor burden, the prognosis po sa patient is decrease or uh, the prognosis is not that good. Okay, meaning there's a lot of cancer cells and there's a possibility na of metastasis. Okay, metastatic breast cancer. Another tumor marker, you have CA549. It's detectable in sera of healthy men and women. And during, if there's malignant disease like breast, lung, prostate, and colon cancer, CA549 is elevated. Okay. Now, elevations not normally observed in the early stages of breast cancer. Okay, so it's usually increased during the advanced stages now of breast cancer. Okay. Um, so that's the problem with CA549. You cannot use this one for early detection. Okay. But it correlates with tumor burden. So the number, okay, of cancer cells inside. Okay, and may prove useful for monitoring treatment and disease progression. So unlike CA15-3, you cannot use CA15-3 for monitoring the effectiveness of treatment. But for CA549, it's useful in the monitoring of the treatment regarding breast cancer. Okay, so for testing of tumor markers, you need to test a lot of tumor markers to correlate. Okay, dili pwedeng one test lang i-perform. You need a panel of tests. Okay, so just like this one, CA549 and CA15-3, you can use these two tumor markers for the detection of breast cancer. Okay, one, the CA15-3, you cannot use that one for monitoring, but CA549 uh, is good for monitoring the treatment for breast cancer. Okay, the effectiveness or effectivity of treatment. Okay, so that's all for the part 2 of our discussion regarding tumor markers.